Did you know your urine can tell a lot about your health? It's a question that may not cross your mind often, but it's an important one nonetheless. Today, we're going to delve into a topic that's not commonly discussed, yet holds a wealth of information about our well-being. We'll decode the secrets hidden in the hues and consistencies of your urine, and reveal what they could mean for your health. So, stay curious and stay tuned to understand what your urine says about your health. Urine color can vary significantly, and it's essential to know what each color indicates. Just like a personal health barometer, the color of your urine can provide a sneak peek into your body's overall well-being. Let's start with the basics. A healthy urine color typically falls within the spectrum of pale yellow to deep amber. This coloration is due to a pigment known as urochrome, which is a byproduct of the body's natural breakdown of old red blood cells. The intensity of your urine's color can change throughout the day, depending on your hydration levels. When you're well hydrated, you'll notice that your urine is a light, straw-like yellow. On the other hand, if your body is crying out for water, your urine will likely be a darker shade of amber. So remember, the key to maintaining a healthy urine color is staying properly hydrated. However, urine can sometimes come in colors that don't fall within the normal yellow spectrum, and these instances warrant more attention. For example, if you notice your urine is a red or pink shade, this could be due to a variety of factors. It could be something as benign as having eaten beets, blueberries, or rhubarb. However, it could also be an indication of something more serious like a urinary tract infection, kidney disease, or even tumors. And what about green or blue urine? Sounds bizarre, right? While it's quite rare, these colors can occur due to certain medications or medical procedures. They can also be a sign of a rare genetic disease or a bacterial infection. Now don't panic if you see these colors. It's important to remember that all bodies are different and react differently to various factors. However, consistent abnormal urine colors should not be ignored and should prompt a conversation with your healthcare provider. So, next time you see a change in your urine color, remember that it could be a sign of your hydration level or potentially something more serious. After all, paying attention to these small details can go a long way in ensuring your well-being. While hydration is a common cause of color changes, some unusual urine colors can indicate specific health issues. Now let's delve into the nitty-gritty of what these abnormal urine colors might mean for your health. If you're seeing red or pink urine in your toilet bowl, don't panic just yet. While it might be alarming, it's not necessarily a sign of a serious problem. It could simply mean that you've eaten beets, berries, or certain food colorings recently. But it could also mean that there's blood in your urine, a condition called hematuria. This could be due to a urinary tract infection, kidney stones, or in rare cases, bladder or kidney disease. On the other hand, if your urine is brown or dark-colored, it could suggest a problem with your liver. Dark urine could be a sign of dehydration, but it could also indicate a liver disease like hepatitis or cirrhosis. Certain medications and foods can also change the color of your urine to brown. So if you're noticing a persistent change to brown despite drinking enough water, it's worth mentioning to your healthcare provider. Now let's talk about orange urine. It might simply mean that you've consumed a lot of carrots or vitamin C. However, it could also indicate a problem with your liver or bile duct, or could be due to certain medications. And what about blue or green urine? Yes, it can happen. This is usually caused by certain medications or medical procedures. In some cases, it could be due to a rare genetic disease or a bacterial infection. Lastly, if your urine appears cloudy or murky, it might indicate a urinary tract infection. It could also be a sign of kidney stones or other medical conditions. It's important to note that certain foods, medications, and supplements can cause unusual urine colors. So, before you worry about a serious health issue, consider any recent changes to your diet or medication regimen. Knowing these color changes can help you identify potential health issues early. Remember, when in doubt, it's always best to consult with your healthcare provider about any changes to your urine color. Apart from color, the consistency of your urine also holds clues about your health. It's not something we usually think about, but it's worth considering. Healthy urine tends to be clear or slightly hazy. This is the result of your body effectively filtering out waste products and excess water. If you're properly hydrated, your urine should have this appearance most of the time. But what happens when your urine isn't clear? Cloudy urine, for instance, can be a sign of a urinary tract infection or UTI. When bacteria make their way into your urinary system, they can cause inflammation that results in cloudy urine. This is often accompanied by other symptoms like a burning sensation during urination or a frequent urge to go. Now let's talk about foamy or fizzy urine. This can be a bit alarming to see, but don't panic just yet. While it can sometimes be due to minor causes like rapid urination, It could also suggest something more serious like protein in the urine, also known as proteinuria. This can occur when your kidneys aren't functioning properly and allow protein to leak into your urine. In some cases, this can be an early sign of kidney disease. In conclusion, the consistency of your urine is more than just a detail. It's a potential health indicator that shouldn't be overlooked. So, paying attention to your urine's consistency can reveal important health information. While observing your urine can provide valuable health insights, it's not a substitute for regular medical checkups. When it comes to our health, we all should be proactive rather than reactive. It's important to remember that changes in urine, while potentially indicative of a health issue, are not a definitive diagnostic tool. There's a world of difference between observing a symptom and understanding its root cause. Our bodies are complex machines, and sometimes what may seem like a small issue can be a sign of something more serious. That's why it's crucial to have regular health checkups and consultations with healthcare professionals. They are equipped with the knowledge and tools to interpret these signs correctly, guide us through the necessary tests if needed, and provide appropriate treatment plans. Regular checkups also help in early detection of potential health issues, increasing the chances of successful treatment significantly. Remember, your body has its way of signaling when something's off, and your urine is one of those signals. Stay healthy, stay informed.